We're going into the health segment, and of course, we're going to have a discussion with Dr. Kelvin Owusu, Medical Director, Optimacare Diagnostics. Good morning.
Good morning.
How are you, Doc?
Very well, and you?
Awesome. I'm great.
Wonderful.
Right, so today is the 1st of February, World Cancer Day. Yeah, I mean, it's celebrated each year. To provide an opportunity to rally the international community in fighting, of course, the preventable sufferings that come from cancer. And so this year the theme is I Can, You Can.
Yes,
right.
It
So
is.
I'd need you briefly to paint us a picture of what we're dealing with when it comes to cancer, and then briefly we can take a message or two on that, and then we'll move forward.
Well, as we've discussed previously, cancer is essentially when the cells of the body go haywire. They start dividing on their own accord, and so under no control. And that's a problem because the body is not meant to behave like that. There needs to be some level of control. Cells are produced when they are needed, and they die when their lifespan is exhausted. Cancer cells don't listen to anything, and so they start dividing against all the rules, and then it ends up causing problems like spreading to other parts of the body and all that. Of course, the diagnosis of cancer also sometimes is a bit difficult because most of the cancers are hidden, and by the time you see symptoms, it's probably well advanced, and so that's why screening is very, very important, and so everybody needs to check some especially depending on your sex and your age. There are some particular cancers that you need to be mindful of, like cervical cancer, which we discussed all through January, like breast cancer for females and also males, like colon cancer. There are cancers of every part of the body, and so we just need to be careful. We need to read about cancers. We need to know our family history because cancers tend to run in families. So if your family member has had a particular cancer before, you need to be more conscious about that particular cancer because it runs in families. So these are a few things we need to take care of.
More or less, it's hereditary.
Yeah, a lot of cancer is hereditary or genetic.
Right. Okay, so that was for cancer briefly, just a touch on it because today is World Cancer Day. But then we have a more immediate problem to deal with. This is a coronavirus. The outbreak was somewhere in Wuhan, China, and now we understand it spread into other countries. This morning we're hearing that Hong Kong has confirmed the first death. Wow.
It's a big deal. It is a big deal. And, the interesting thing is that this is not the first coronavirus outbreak in the world. We've had some in the past, and I'm sure many of us remember SARS. Yeah. It's actually also part of the coronavirus families. There's also been a Middle Eastern respiratory virus, which is also a member of the coronavirus. So coronavirus has been with us for a long time. Most coronaviruses are self-limiting, but occasionally we get an outbreak like we are seeing now where they mutate and start causing issues because we are not ready for the new strain. So what I'm trying to say is that the coronavirus family is not a new virus like that, but when it comes to viruses, they mutate quite easily, and especially in a population or a place where there's such a huge population of people and animals where they interact. Like we suspect that it started from the animal, the farm, the seafood market, and it's because of the volume of people that go through there and the volume of animals that come through there. And the way these people interact with the animals or the seafood and all those things, so it's ripe for mutation to occur, and that's what we actually experiencing currently with the 2019 coronavirus that is spreading around the world now.
Right. So that means this is a particular type of coronavirus.
Yes, it's a particular type of coronavirus, and as I said, it's a new virus because it has mutated from what we know, the coronavirus we know and we are used to, and that is why, for instance, there's been no cure yet or no vaccine. Because we have to catch up with this new strain of the coronavirus.
Is this as deadly as the SARS was?
Well, it's a bit too early to determine that, but it's showing some. Let's say it's serious, but we can't compare to SARS yet because the numbers are still coming in and the research is still ongoing. So it will be premature to make that conclusion at this point.
Right. So I have an issue with this because we are not comparing to SARS yet because we are not recording as many deaths as we recorded with SARS. But from where I said, it's like we are relaxed because we are not seeing so many deaths. Should that be a source of worry?
Well, it should be a source of worry because, it is an outbreak and it's causing death all around the world. As you said, Hong Kong recorded I think and when I was coming in, I heard that they've now had the first confirmed case in Europe. That's a gentleman in Belgium has been diagnosed of having this new coronavirus strain. So it's spreading. Thankfully, we haven't had a confirmed case in Africa yet. We are hoping we don't have to deal with it because the resources to combat this thing is it's a serious strain on everybody, the economy, and even the fear. The fear that there's coronavirus next door is not going to be easy to live with. So we really have to consider that it's a serious condition, a serious disease condition that is possible at spreading. It's not yet a pandemic yet, but WHO has declared that it's a worldwide thing that we need to pay attention to.
Right. So now we know that the virus is here. It's a new strain that is out, and we know the dangers associated with it. What are the symptoms? What will you see in a person who carries this virus?
So this is also what makes it a bit more scary, because the symptoms are generally non-specific. When I say non-specific, somebody who has a common cold would also have similar symptoms to somebody who has a coronavirus. So somebody has runny nose, is coughing, has fever. When I say fever, I'm talking about temperature. These are some of the signs of coronavirus. And specifically with the coronavirus, so the research is suggesting that, and I use the word suggesting because a lot of this information is preliminary. It's not, most of them is still coming in. And the research is suggesting that people can even spread the virus before they show symptoms. And that adds another level of...
But that's dangerous.
Yes,
that's scary.
Yes, because usually what we know about viral infection is that the person is most infectious when they have symptoms. The person is most infectious at the height of the symptoms. So when the person has the most fever, is weak, is lying down, vomiting, those kind of things, that's when they tend to be infectious. So then, and obviously, if you know that somebody has symptoms, if you are going to interact with this person, you take the precautions.
Exactly.
But now this coronavirus is showing that it can spread even before symptoms begin to show in the patient. So that makes it a bit more difficult to handle. And that's a big deal. So it's not just about looking out for symptoms. It's about taking the precautions that are necessary to avoid yourself being infected, which is also not that easy because this is an infection that is spread through droplet infection. What that means is that somebody within a certain proximity to you maybe coughs. Once you cough, you are going to release some droplets, some little bit of secretions into the atmosphere. Okay. Once you are within that proximity and you inhale this droplets, you are exposing yourself to the infection. If you as you are speaking, there are droplets falling all over your hands and all those things. If you shake the hand of somebody who is infected and you don't wash your hand and you touch your mouth, your eye, you are exposing yourself to these infections.
That's very scary.
Yes. So now let me just say that this is not peculiar to the coronavirus alone. A lot of the viral infections are airborne, so common cold, other things are airborne, and so this is how they all spread. Now, but the thing is that if you had a common cold infection, it is self-limiting. When I say self-limiting, what I mean is that your body will eventually deal with the infection within a period of time, mostly within a week or two. But with the coronavirus, because it's a bit stronger than the common cold virus, so your body cannot deal with it by itself. And so you need supportive treatment because, again, there's no cure yet. There's no vaccine yet. So once you have it, the only solution is to go to hospital and have the supportive treatment given. And then it helps your body to now try and overcome the infection. So it's serious. I don't know. I can't overemphasize how serious it is.
I mean, I've read about it, but the picture you're painting now makes it even more scarier.
It is. It is scary, and especially for we, the health workers, because like I said, the person coming in does not even have to show symptoms, that he or she has the infection. Once somebody may come in I was reading a story about the first doctor who tried to blow the whistle in China, Dr. Lee. And he actually got infected when he was treating a patient who had come in with glaucoma. Wow. So it's not as if the patient had even come in with the respiratory issue. But because this patient also had that infection, whilst he was attending to her with respect to the glaucoma, then he caught the infection. So for health workers, you need to be extra cautious when you are even interacting with patients because you cannot tell who has been infected or who has not been infected. So it comes down to the protective mechanisms that have to be put in place, to prevent people from coming in contact with the virus in the first place because you can't tell who is going to infect you.
Well, let's now look at the precautionary measures, first from the individual point of view and then largely as a state, as a nation, what we need to do.
So from the individual point of view, personal hygiene is critical. Now, when I say personal hygiene, I'm referring primarily to washing of hands. Because, again, you can't tell who is infected and who is not infected. Right. So we have to be more conscious about washing our hands more frequently than we would usually have done. If water is not available at that particular time. Oh, but before I move on, washing your hand with soap.
Right.
Not just washing your hand. You need to wash your hand with soap, so that you minimize how much contact you are going to have with the droplets on your eye or in your mouth. Because if you touch food with your hands, the droplets will be transferred to the food, and you're going to eat this food. That's exposure right there. And so wash your hand with soap is very, very important.
Okay, so Dr. Kachi, but that means we can catch the virus through the various openings on our bodies.
Yes. When you can inhale it, you can eat it, you can contact it if you touch your eyes. So it's very important that we keep our hands clean. If you can't have access to water and soap, the next best thing is sanitizer. And there are lots of sanitizers on the market. Find a good quality sanitizer, and then make sure that you sanitize your hands as much as possible to minimize the contact with the droplets. So these two things are critical. Of course, if you know, obviously, that somebody has an infection, somebody with running nose, is coughing, stay a distance away from that person. They have something called a meter rule. Stay that distance from that person to avoid direct contact with the droplets from him or her who is infected, who has the infection. It doesn't have to be coronavirus. I'm talking about infection in general. Because like I said, so far there's no coronavirus in Africa, so we have to be cautious in how we communicate that information.
Right. Now let's look at the country Ghana. We've heard some measures. This morning I understand there's a technical committee that is meeting, going to the airports to take a look at preparations and all that. This screening, temperature check-in and all that, is that enough? Well, so as I've already said, what makes this thing unique is that people can spread the infection even before they show symptoms. So just checking temperature is not enough. However, it is also better than not doing anything at all. Short of banning flights from Wuhan, or I don't know if it's even possible to ban flights from China because there are so many, there's so much business going back and forth. I don't know if that's even possible. But short of banning those flights, the next best thing we can do is to check temperatures. But we also have to be observant so that if you notice somebody is not well, particularly if somebody has returned from Wuhan or China for that matter, we need to be ready to report this person to the authorities, or at least encourage that person to report at the hospital so that we can have the proper quarantine measures put in place. Obviously, if somebody is not well from the flight, then that person doesn't enter at all. Immediately goes to the quarantine, which I'm sure will be set up at the airport or near the airport, so that we can reduce how much contact we are getting with infected persons. There's in Accra we have the Tema General Hospital and then the Accra Regional Hospital that have been dedicated as centers for this thing. And yesterday in the news I saw that they have put some measures in place to quarantine patients people who are suspected of having this particular viral infection. So and eventually in China, what they are doing now is they're encouraging the wearing of face masks, but that's because it's confirmed that the disease is there. In Ghana currently, we don't have the disease yet, so we don't necessarily have to wear face masks around. But that's one of the things that might also come in should we have a confirmed case in our midst. We would have to protect ourselves because, as I said, it's contact of the droplets with your mucous membranes, eyes, nose, and then mouth. So if you wear the face mask, it prevents the droplets from getting direct access. And once you are going to take off the face mask, you make sure that you have washed your hands so that you don't negate what you have done. But we are not there yet, and so for now, it's personal hygiene, being observant, and avoiding close contact with persons who are showing symptoms. These three things will help us minimize the incidence or the likelihood of spread. Right. Well, our news team has gone round, did some checks, went to the Accra Regional Hospital, also went to the airport, and we've seen that at least some measures are being put in place to actually prevent this outbreak of coronavirus. We want to go for a very quick break. When we come back, we'll continue the discussion with Dr. Kelvin here in studio. This is Breakfast Daily. We'll be right back. Welcome back. This is Breakfast Daily on Citi TV. Currently, we're having a discussion with Dr. Kelvin Owusu on coronavirus. Doc, I'm curious. So, this virus is harbored in our droplets, right? So, I want to find out how long can this virus survive in a droplet? Say I speak and then I spit out, droplet falls. How long can it survive? Say I'm alone in a particular environment. How long can this virus survive till the next person gets to that particular environment to contract or to come into contact with this virus?
This is a very difficult question to answer. So first of all, like I keep saying, it's a new virus that we don't know much about. So we don't have that information as at now. But generally, viruses don't usually survive for long outside of their host, But then the thing is, most of the time, we don't even, how often, if I ask you, how often do you even touch your face? It's so, like, we don't even think about it.
Exactly.
So once you step out, once you talk to this person, the likelihood that you are going to touch your face is very, very high. So that virus doesn't even have to spend that much time outside the jurisdiction of the host to cause damage. Because subconsciously we keep touching our face, we keep touching our mouth, and we are eating almost all the time. You see some fruits, we don't even wash the fruit, we just pick it and start eating. So it's better to be cautious, to wash your hand more frequently than to hope that the virus is dead or inactivated. Also, some viruses can how do I put it? They can protect them. There are mechanisms to protect themselves when conditions are harsh, and then reactivate when conditions are conducive. So we don't know much about this particular one, so we can't even tell what is going on with this particular virus.
But then obviously it's demonstrated some similarities to other viruses.
Yes. That's why I started by saying that this is not the only coronavirus outbreak that we've had. We've had two others in the past. The SARS is the one that people would remember, because that was also a worldwide thing. We've also had the small pandemic. We've also had the Middle East version as well that came up a couple of years ago. So the coronavirus is a virus that has been with us for a long time, but occasionally the mutation comes up, and then we have what we have now.
Let's look at a transfer from one host to another. I want to focus on a transfer from a human host to a non-human host. And I'm asking this because of the kind of environments we usually find ourselves in. Not the best. So is there a possibility of a transfer from a human host, so this virus can hide in a non-human host till it's able to locate another human host and then move into that person? So
actually, this virus initially, or rather is believed to have originated from animals,
right,
and then was transferred to humans. So one of the things that caused the delay was that the authorities did not believe that human-to-human transfer was possible.
Right.
So they thought that it was only people who had made contact with the particular infected animals.
Seafood.
Yes, but now we have seen that human-to-human transfer is possible, because a lot of people who are now being diagnosed never had contact with animals in the first place. What we don't know now, what we don't know yet, is whether human-to-animal is possible. I don't know if you get what I'm saying. From animal to human, there's a suspicion. From human to human, there's also a likely route. But from human to animal, we don't know yet.
Okay. But for now, from animal to human has been established.
Yes, pretty much has been established. And then from human to human is also well known. But we don't know if it can go from human to animal.
Okay.
We don't know yet. We are not going to say it's not possible. We are going to say that the research hasn't given us that result yet.
Right. But then the nature of our environments we find ourselves in, is there a contributing factor?
Well, once you are interacting with animals, you are going to have some animal diseases transferring to humans, But this is actually called a zoonotic infection. It's something that we know. So most of the time, farmers who deal with animals tend to, something like bird flu. We've had occasions where the bird flu virus has been transferred to humans and so on and so forth. But mostly it's just the people who have direct contact with the animals, But like I'm saying, because this particular one, we don't have any evidence from human to animals, it's difficult to say concretely that it is possible. However, in general, once you work closely with animals, transfer of diseases across the barriers is known to happen occasionally. But this particular case, we don't have any evidence yet. But of course, if you are somebody who works with animals and the animal is showing signs of disease, you need to send that animal for treatment. But first of all, you need to protect yourself. So wear gloves, wear face masks, because once you don't know exactly what is going on, you need to protect yourself and prevent yourself from being exposed to that particular disease that is going on.
Right. We've looked at the symptoms. We've looked at preventive or precautionary measures. But I am scared because the fact that a patient can become infectious even before they begin to show symptoms is very, very dangerous. I want to find out, aside the fever, the running nose, the flu that we see, what other behaviors are you likely to see in the person who has come into contact with the virus?
Well, general weakness, vomiting. And the thing about the coronavirus, or the people, a lot of the patients who have passed on died from pneumonia. So there could be a complication of other germs, other bacteria or viruses that will come and complicate the already existing thing, because now your immune system is so weak that anything can happen. And so, but the ones that you would notice as somebody walking on the street would be the coughing, the running nose, the weakness, headaches, fever, vomiting. These are the things that most people will notice, and then later on maybe the other things will come on, but those things you cannot see, with your eyes, because you have to run various tests and all that. And I must say that, as I've said already, there's no cure. The treatment is supportive.
Right.
So if the person is vomiting, you obviously want to minimize or abort the vomiting and replace the fluid that the person is losing. If the person has a fever, you want to bring down the temperature. If the person cannot eat, you want to give some maybe IV fluids or even intravenous nutrition. Yeah. So all these things are supportive. The main causative agents we don't have a cure for, but sometimes or our immune system is such that when it recognizes an attack, it can adapt and overcome. So the idea is to support you whilst your immune system fights off the infection. That's basically what we are doing now. But the research is ongoing to look for a vaccine, to look for treatment options so that we can overcome this infection. And if we are to look back into history, this is not the first time an outbreak has happened. And every time it happens, we get better at handling it. So that's why, for instance, when there was the SARS outbreak, the amount of damage or the impact the SARS outbreak had in the initial stages was much, much worse than what we are seeing now. Yeah. It's because we keep learning from whatever is going on. So now the quarantine measures are better. Even the reporting systems are better. So that within that short time, the reports had gone out and everybody was on guard, looking out for this or that to make sure that we don't fall victim to it. It doesn't also mean that some people have not died already. Yeah. It's unfortunate that some people have passed away, but we have to do our best to minimize the impact as much as possible. And that is why education is very, very important.
Great. Thank you very much, Dr. Kelvin Owusu, Medical Director at Optimacare Diagnostics. We're very grateful. We've had a wonderful discussion on coronavirus. Can we say this is a respiratory infection?
Yes, it is. It is. It's a respiratory infection.
Awesome.
Hi there. I hope you enjoyed the show. Don't forget to subscribe, like, comment, and share with all of your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.